Hello everyone, thank you for joining us again in this new edition of Signals Understanding the Coronavirus Crisis. As a quick reminder, your microphones have been muted by default, so please, if you have any questions, feel free to type them in the question dialog box. Thank you.
Thank you. Hello, everyone. Very happy to have you with us today again for this edition of our Signals webinar, which is part of our ongoing program to help us understand what's going on as we plan for the future in this new context. So we'll be happy to share with you today, again, some updates on how people are feeling and behaving around the world, and also to share some perspectives on important transformations within our new environment. To do this, Simon will first remind us of our available resources, and Chris will tell us about 5 new things that we've learned by monitoring the global situation so far, and what this means for brands and for companies. And we will also have a live account from Brazil with Diego. After that, Rina will tell us about the rise of self-care, and Natalie will end telling us about sustainable futures and how citizens and consumers are looking at this as we move into our new world. And I will now pass on the floor to Simon.
Thank you, Jennifer. Hello, everybody. It's great to be with you. As Jennifer says, we're looking ahead to this new world. We may be some months now into this crisis, but things continue to change and evolve week by week. And so with that in mind, we've got this COVID homepage where we upload all of our latest information and resources to make sure that we are always up to date with the latest findings, the latest research, the latest patterns. Today we published the latest in our series of research digests, which is a partner to this webinar program, enabling you to browse some of the recent research and analysis we've been doing. Includes a focus on Brazil, and Diego will share with us his perspective in a moment. A couple of things in that report perhaps to pull out. Questions, of course, about how the recent experience is changing our food habits, our food consumption in the medium and longer term, and a report there from our MENA team. Other questions around, frankly, what happens next, and financial concerns are what worries the world survey shows big rises in fears about unemployment. So what we're finding is really important that we stay close to how attitudes are changing, how behaviours are starting to evolve. And with that in mind, we're delighted to have Chris back again, who's been reflecting on the latest patterns that we are observing from our international study and pulling out some of the things we all need to know as we think about what happens next. Over to you, Chris.
Thanks so much, Simon. So yes, for those of you who might be new to this call, the Essentials study is our global syndicated tracker of attitudes and behaviors. So each week we connect with about 1,000 consumers per country in 16 major markets around the world. And then we supplement that with a longitudinal ethnography in a number of countries. And we're going to be referencing both of those sources as material for these 5 latest things that we've learned that we wanted to share with you. So getting on with it quickly, we'll do a kind of a whistle-stop tour here of the 5. The first learning is a story of advance and retreat. You might have seen this chart before, where we ask people to classify themselves into one of 8 groupings to best describe where they stand in their personal COVID journey. Now, in the past 4 weeks, we've seen a doubling in the percentage of those who say they've advanced to either the restart phase or beyond. And on the surface, that sort of steady advance to reentry could be interpreted as a very encouraging sign of a return to normal. But that view to normal actually continues to retreat into the distance. So another thing we ask people each week is how long they think it's going to take before things feel like they're getting back to normal. And as you can see in the graphic here, this week we actually saw people in 15 of the 16 countries where we're surveying reporting a longer term view of that than they did just a month ago. So even as we may be advancing or emerging from our homes, it is dawning on us that we're making up new rules of engagement as we go. And so a return to a normal life is actually an increasingly distant vision, hence the bit about advance and retreat. So on to learning number 2. Speaking of rules of social engagement, I think as we kind of toddle towards this new social climate where we are reinventing the rules of interaction as we go, we're going to set some new records for social awkwardness here. Like the family featured in the ethnography that we're referencing here to the left, a lot of us are taking those tentative first steps, to reentry with mixed feelings, some uncertainty, and we're finding even that something as simple as the definition of personal space has become even more elusive. Now, in this case, I can't show you the video here, we don't have time, but we saw a family actually get into a big argument at a family reunion about what's safe behavior and what's not safe behavior. So I guess learning number 2 is, welcome to the age of social awkwardness. Third thing, here we're looking at those phases again, and they're kind of plotted along the bottom of the slide. And we're looking at those who have either felt or feel the threat of medical impact, and those who have felt or feel the threat of financial impact at each phase. And what we'll see here is people are in the early phases. Financial and health setbacks are occurring at about the same rate. But as reentry begins, as you get to kind of the right side of the screen, the health events start to abate while the financial distress remains. You couple that with this increasing desire that people have to reignite the global economy, and you can see here in the graphic, there's been quite an escalation in this in just the past 4 weeks. So we put these two pieces together and we say, as people are making their way through the phases in their pandemic journey, medical concerns are taking a little bit of a back seat right now, but financial concerns and a desire for economic recovery are not subsiding. Fourth thing to know, this is kind of a quick one, but one of the other things we ask is how much change are people willing to make in their lives as they adjust to kind of the new situation. So here we're capturing by country people who are willing to make major changes or completely change their lives. And what you see here, if the question is how willing are people to change, the answer is kind of depends on where you ask the question. So in some places, India, Mexico, South Africa, Brazil, there is a great willingness to change lifestyles as a result of the pandemic. But there are others, Germany, Russia, that are completely on the other end of the spectrum. And in some places, the willingness to change actually varies within country, which takes us to the USA. So we got a little spotlight here on the US. When we view the essentials data among a host of demographics in the US, some of the most interesting findings come when we compare Republicans and Democrats or political affiliation. And we see a real kind of convergence and divergence in the data. And some of the convergence might surprise you a little bit. But what we're finding here is that Republicans and Democrats in the United States are very similar in that they are going through the same stuff, they are feeling the same emotions, they're missing the same stuff, and they're doing the same stuff. But even with all this shared experience, shared emotion, shared coping mechanisms, they completely differ in their perceptions of the COVID threat, their level of confidence in economic recovery, and their willingness to re-engage in previous activities in the near term. I'm only showing you a partial sliver of the data here, but pretty much no matter what activity we ask people about, Republicans are 2 or 3 times more likely to assert a willingness or desire to get back to those types of activities. So I think learning number 5 here is, we can experience things in the same way, but we can see the future completely differently. So recapping the 5, while we are kind of making an advance towards reentry, the vision of normality is in concert retreating into the distance. As we get a better glimpse of what reentry looks like, we realize that normal is farther and farther away. And we are indeed entering kind of this unprecedented era of social awkwardness. And then as concerns about the health crisis subside, we have to realize that the wake of the financial aftermath does remain. Fourth, there is a willingness to change behavior in some countries, not so much in others. But the variance isn't just between countries, it's also within countries. We spotlighted the USA, we could have gone to some others as well. But then the big point in terms of the little USA spotlight that we covered, we can experience things very similarly and yet see the future and our willingness to engage completely differently. So in terms of what this might mean, for brands, I think we are going to continue to expect brands to be more empathetic, inclusive, involved. And there is an opportunity here for brands to deeply connect, to play a leadership role in changing society for the better. Speaking of which, Natalie's going to come on in a little bit and talk about sustainability. But all this doesn't mean that brands should abandon their commercial interests. Far from it. Again, we've said this before on these, but brands play a huge role in economic recovery, and people get that. And remember, the financial wake of the health crisis is scaring more people right now than the prospect of getting sick. So brands have a real role to play in that recovery. The fourth point, like you and me, brands need to find their place in this awkwardly evolving world where the rules of social interaction are basically being rewritten on the fly. And then lastly, if I'm a marketer in the US, I'm asking myself a couple of questions. One, how do we kind of raise consciousness of shared experience, shared concerns, shared longings, shared states of mind? But at the same time, how do we start to ease some of the concerns of Democrats while speaking to the eager excitement of Republicans? Thank you so much. As always, a very good honor to visit with you this morning, and thank you for your time. And back to Simon.
Oh, thank you, Chris, so much for that. It's fascinating from the age of awkwardness through to some of the questions about marketers and marketing in the US, which brings us on from the biggest market in North America to the biggest market in Latin America. And I'm delighted to have Diego with us. Diego, hello. How are you?
How are you, Simon? Good morning, good afternoon, everyone. It's a pleasure for me to be here with you. Wonderful insight from Chris.
It was great, wasn't it? Well, I mean, to start with, you're joining us. I think it's fair to say you're joining us from your home in Sao Paulo.
Yes, exactly. I'm from my home here in Sao Paulo, like many people working from home still. Yeah,
absolutely. It's all over the news outside Brazil at the moment, is that the country has been so affected by coronavirus. And really, we want to take the opportunity to hear a little bit more from you about what's happening on the ground. So perhaps you could just share with us the latest from Brazil this last week or two.
Yeah, for sure, Simon. It's very important to understand that we are like in a tipping point here in Brazil. We will probably hit 1 million confirmed cases of COVID-19 in Brazil, probably above 50,000 deaths still confirmed this week. So the tension has risen a lot here. Brazil is like many countries within a single countries. We have very different regions, different in culture, economics, these kind of things, being affected differently as well. So we see the northeast part of Brazil being highly affected with not so good health system in place. And you see the south of Brazil, southeast, where Sao Paulo is, in more, controlled situation. So this has brought a lot of tension, a lot of controversial measures from the government as well that the different states have had to deal with. And we are now, let's say, in the whole country, at least in the phase 2 of the pandemic, where the reopening starts. So the tension is rising. The companies are starting to prepare for this reopening. And I agree totally with Chris that big financial concerns still remain. So we will see what happens next, but this is a very tense moment in Brazil.
Yeah, absolutely. Well, thank you for just giving us that update. Now, one of the things that people on the call may or may not know is that you're an Argentinian living in Brazil. Tell us a bit about your own experience in these recent times.
Well, you know, I live in São Paulo, which is, again, like a country within Brazil. The state of São Paulo has 40 million people, citizens, so it's very large. So it's very particular what I am going to tell. I have two daughters. One is Brazilian, so we have been in Brazil for 10 years already. So I'm kind of, you know, 25%, let's say 1 out of 4 in the family Brazilian, so 25% Brazilian. And, you know, as a family, we had to adapt quite much, and our routines, daily lives, me working from home, the girls doing from home, the school as well. So it's been, you know, very interesting to see how the family interactions goes on, and many things that we have talked a lot during the last Signal editions as well. As Argentinians, we used, and our family used to travel a lot. You know, it's only a 3-hour flights away from Buenos Aires. And usually we had been traveling there to celebrate birthdays. The families and the grandparents, my parents came here also to celebrate our daughter's birthday. So it's been difficult to, despite, you know, that this social distancing would have kept us apart a little bit during this time, being unable to travel and you not having the possibility to actually being together has been tough. One of the things that I will probably remember for a long time is my mother saying, I have never been so many days apart from my granddaughters ever. So I'm looking forward for, you know, traveling open again and meet her again. So, you know, difficult times, but we are coping with it.
Yeah, well, no, absolutely, and it's so sobering to hear the experience that's sort of taking place in the country, and I guess balancing that with, I guess what we're trying to do, including in these sessions, is to try to think ahead to what may be on the horizon, or perhaps on the near horizon during the coming period. For those of us watching Brazil, want to understand the market some more, what should we be looking out for in terms of perhaps how Brazilian consumers' behaviours are going to be changing and adapting as we look ahead?
Well, you know, Simon, Brazil is going through a major transformation in terms of market dynamics. It was expected this year to be a year that Brazil was going back to growth again in terms of the economy after very bad years. And we have seen some things accelerating now with the pandemic, and others, you know, slowing down. So one of the ones that are speeding up a lot, obviously, is e-commerce and everything that has to do with digital purchase of products and services. You know, there's an interesting fact that I was reading this week. We had almost more than one company being opened in the internet per minute during the last 2 months here in Brazil. So you see a rise of this ability to sell online, and this has implications for small and large companies, you know. And there's a big question mark about how is this going to continue, because we have a lot of people using it and a lot of new adopters as well. So how is this going to keep on once the you know, offline stores start to reopen? What habits will remain? Which ones will come back to what it was in the past? The second one, which is the one that actually has slowed down a little bit, was, as I was saying, after a couple of, let's say, bad years in terms of economics for Brazil, innovation from the companies were like put on hold, and now this year had started to take off. Mm-hmm. So we saw many new products and brands and categories like opening and bringing, you know, based on sustainability, many kind of things, healthiness. But this pandemic has put all of us, including us, you know, in like, what do I do now? So we need to think about, you know, this innovation pipeline in terms of what is actually relevant for the people nowadays and what is going to be relevant for the short and mid term, so we can keep up with these innovations, because we know that the consumers are avid to try these new things.
Absolutely, yeah, and so much up in the air and so fluid. Diego, thank you so much for joining us. That was really great to get your insights on what's happening and what we might be looking ahead to. I'm going to hand back to Jennifer now in the studio in Milan.
Thank you very much, Simon. And from Milan to Sao Paulo, Diego, I liked your quote on what do I do now, right? Very interesting. Innovation is restarting and that brands and companies are starting again to invest. And I think it's an interesting connection with something that Chris mentioned as one of his sort of wrap-up points, which is the leadership role that brands and companies play in society. And I was wondering how you see this in this very difficult Brazilian context.
That's a very good point, Jennifer. And I was thinking about that when Chris was presenting, that we saw the brands playing a huge and very relevant role in the society in supporting and walking through this pandemic with people through the crisis. And we see that there is expected, this role to continue after this. Many people say, I don't want this to be only during this crisis. I don't want to see this brand supporting us only during this crisis. So it is very important to tie these new strategies with the purpose of the brand, try to rethink costs, these kind of things, because people will definitely be more loyal to this brand that have helping them go through the crisis, but also supporting the society ongoing.
Great. Yeah, so there's a strong theme of consistency in addition to empathy, right? Which is
absolutely
and relevant as well in Brazil. Thanks so much for that perspective from the ground. Very, very good. All the best to you. And so another thing that we've seen change a lot over the past, years, months, but in the last few days and weeks accelerated is the rise of self-care. And we're very happy to have Rina with us today, one of our global experts in the healthcare area, who is going to talk to us exactly about that. Rina?
Thank you. Thank you very much. Pleasure to be here and talk about health and healthcare. One of the things that binds us all is that we care about our health. Health is very personal. And COVID-19 and what's been happening in the last few months has been pretty incredible for all of us on a personal level, if we've had loved ones who suffered through the coronavirus, and also just thinking about our healthcare infrastructure and all the changes that have happened. I've been focused on digital and connected health for the last 4 or 5 years, talking about the potential. Oh, wouldn't it be wonderful if we could do this or we could do that? And it's been fascinating to see all the change that has taken place in the midst of the crisis. What we've seen is a rise of digital in terms of telehealth and virtual care. We've seen more remote consultations taking place because we physically cannot go see our doctor. Self-testing and personalized care, the idea that now we can get tests sent to people's homes, get a swab done, get a result, and see if they are suffering or not. There's going to be a rise in more testing at home thanks to the pandemic, and there's a lot of production happening around how can we get people to have a better understanding of their health from genome sequencing and DNA testing, or perhaps given more personalized vitamins that they can take for their health and keep their immunity up, because the conversation of immunity has risen in importance. Technology such as wearables and apps were there. Many of us proportion globally, 12% of the population around the world pre-COVID were engaging with their health through technology such as apps and smartwatches. That has risen during this time, and things such as triage chatbots, because so many of us have the same questions around the implications of coronavirus. A chatbot is a fantastic, scalable way of getting quick health information. So many companies launched these apps combined with telehealth products where you could quickly ask questions and get answers. Wearables remain a staple product. I don't know how many of you were active during lockdown. The first 2 weeks I was tracking everything I did, and then it kind of started to deplete. But the idea of how we can engage with our health through all these tools. We saw a rise in the Peloton subscription. So many people who like to spin, investing in bikes and being part of the Peloton community, and now talking about how they couldn't let go of that. With all this data that's been collected around health, what we get is a picture of the population. Population health has been something that's been spoken about, again, for many years, because as we collect data, we get a better understanding of our demographic, of our at-risk population. It helps us understand where we should put our resources. During the course of the coronavirus, this has been a fantastic way for us to understand the vulnerable individuals in our population and try and put our resources towards that. The vision has always been around collaborative care. And I remember being on conference stages talking about this and showing this visual and saying, can't wait for this vision to be realized, that we have our biometric data in our hand, we have our genome sequenced, and we understand what we're at risk of. And we sit with our clinician who has the knowledge and the medical background to make better decisions about our health. That is the epitome of self-care, the idea that we're better informed and we can make better decisions for our health and ultimately prevent disease to the point possible. This vision of personalized care has now to some degree been accelerated during this period. What we know from our data and digital doctor, which is a global study that we've run in over 20 markets, where we spoke to primary care doctors around their experiences of digital and the use of data with patients. And overwhelmingly around the globe, we've seen doctors are very open to connected health, especially as a means to empower their patients. If patients are better informed, it makes their life better and it makes the burden easier. However, there are always going to be reasons to use and reasons not to use. Some of the findings that I think are particularly interesting is a clinician, a primary care doctor, feels far more comfortable having a recommendation of an app or a wearable or a product which helps patients to better manage their health with their medication. So compliance of medicine is really important, whether this is the over-the-counter drug or whether this is a prescription drug. What we know of human behavior, and probably know this about ourselves, is we don't always take our pills as prescribed. We kind of skip things. And that's a huge issue. It's a huge issue around efficiency of treatment. So if technology is an enabler for that, fantastic. Early intervention. If people take more steps, are fitter, make better decisions about their health, their risk of disease comes down. Therefore, we're intervening early. And ultimately, there's an economic benefit, a reduction in practice visits. And what we've seen now with the rise of telehealth is that individuals can have quick consultations remotely that would have taken a lot more time within a practice. There are challenges to that, and I'll come to that in a moment. But there are risks. Patients misinterpreting data that they collect, misinterpreting what the consequence it means for them. Self-diagnoses. Doctors are very apprehensive about any patient diagnosing themselves. They would prefer even the self-testing kits to be discussed with a doctor so they can be appropriately triaged and informed. And finally, data privacy. In this last week, there was a data breach on one of the top telehealth providers where personal data was made available to another patient. Incidences such as that are very difficult for the industry. We need to tackle data privacy and also just the handling of data. Who owns it? Is it the company, the software company? Is it the clinicians at the hospital system, or is it the patient? There's a huge advocacy that we all should own our own data. That's a whole other topic. I talked about telemedicine, and the rise of it has been phenomenal. This is US data where we see on average across specialties, 10% of doctors were engaging with telehealth pre-COVID. That shot up to 80%. Phenomenal. What we saw was regulation relaxing across the US. So before, individuals had a lot of barriers to access. Suddenly, all of that came down. Doctors were also still paid for consultations remotely, which helped galvanize the market. But there were lots of challenges. What technology to use, how to appropriately diagnose someone when you don't really know or have all the diagnostic kits. There are a lot of challenges for doctors still around the telehealth side of things. And what we've seen from the Essentials tracker, the great work that Chris and Natalie have been doing and showcased at the beginning of this webinar, a fifth of consumers around the world for the first time, a fifth of consumers were using telemedicine during the pandemic, and half of them for the first time had this experience. Of all the things that we asked around what's new during this time, telehealth was number one. It was the most interesting new experience that they've had. Good or bad, there are different elements that we can go into for that. We see markets such as China and India having a heavy reliance on telehealth, purely due to the size of the population and a reduction in the amount of doctors that can care for them. But even in Europe and the US, an interesting rise in people who have tried it for the first time and experiencing telemedicine. So what does this all mean? What is applicable to companies who are working within healthcare? Ultimately, it's about universal design, and it's about us taking the learnings of this pandemic and all the technology adoption that's taken place to do much better in how we design our health services, taking on board design principles, preferences, thinking about dexterity, frictionless technology, how's it going to work for every demographic. We also need to think about the onboarding and learning of technology. We're seeing a lot of testimonials from doctors and patients around some of the difficulties they're having with engaging with technology. They're not trained to do medicine virtually. That's an issue. There's a lot of work going on around how we do that better. And finally, it's about experience, customer experience, our health experience. From the moment you have initial symptoms or the moment you decide you want to take better care of yourself, how do you do that? How do you engage with your pharmacy? How do you engage with information online? There's a lot to be said and a lot to learn within this space. But for now, I hand back to Jennifer because I know we still have many other things to talk about.
Thanks a lot, Rena. That was a very, very interesting perspective. And although we still do have other things to talk about, I would still be interested, because there's so much and so many different aspects to consider, so many different things that are changing, transforming. What can we expect next from your perspective in this world? Yeah.
It's a $1 million question. So I think there's a lot to happen. For us right now, there's a big lobbying effort happening. So for instance, the American Telemed Association and many other bodies are focusing on how do we keep the policies in place to enable access. Because if we don't have access, we cannot keep the market going as it is. So one element is going to be, how do we keep that happening? There are also some individuals who just want to roll back and not necessarily continue at this level of tech. So I see a hybrid model in the future. I see a new segment of doctors and patients who are engaging with technology for their health, but it's not necessarily going to be at the level that we're seeing during the pandemic.
Great, thank you. Very, very insightful. Thanks a lot, Rena. And with that, I'm going to hand over to Natalie, who's going to talk to us about sustainability and about this aspects. We're all citizens and consumers, and how does that play out for us all?
Great, and thank you very much, everyone, for being here. And I'm very pleased to spend the next few minutes to talk with you about something non-COVID related, although we will talk a little bit about how it's going to change and evolve in the post-COVID world. But sustainability is something that Ipsos has spent a lot of time understanding and investigating over many years. And one of the things that's really driving this push to sustainability is the alignment of the citizen and the decisions of the consumer. So whether it be the decisions they make about purchases, how they feel about brands, how their political and social activism really reflects itself in some of those personal actions, or in the end, how they bring those together. This alignment of the consumer and the citizen and the decisions they're making are increasingly driving some of the choices that they make when they actually move into a consumer world. And in the context of COVID, we do believe, and there is a lot of room to still talk about these issues. So we show that 7 in 10 believe that, for example, climate change is at least as serious as COVID. And in fact, we see that across almost all of the countries in which we survey. While China and Mexico are at the top of the list, we still see a majority holding this view in Canada, Australia, and the United States. But when we delve into sustainability, there are some challenges and some barriers to really motivating those decisions and how people will actually act. And one of the things is in some ways the definition and the wording. So when we ask about sustainability, we find that it is still very much associated with some of the what we might consider more traditional definitions, recycling, packaging, and how people treat the relationship between products and the environment. We find that some of what we know as the broader definition of sustainability, supply chain management, to be of lesser relevance, or at least not as top of mind to many of these consumer citizens. And in fact, if we just ask people, when you think of sustainability, what comes to mind? There is a variety of things, but they're really all, and most of them, based around this idea of the packaging and what we might call the third moment of truth, when people actually have a package and have to decide whether to recycle or to dispose of in another way. So that's one of the challenges. The second is that there is a division in the public. So we'll talk a little bit, we hear a lot about the say-do gap. There is a sense of responsibility on the part of this consumer citizen. So you see, for example, the second item here on the slide, it's not my responsibility to change the way I live. It is up to companies to provide products that are sustainable. Less than half actually agree with that. So we do have a majority who are willing to take responsibility. And we see this in many of the other work that we do about a feeling of shared engagement and shared responsibility. However, their sense of empowerment on many of these issues is quite limited. So again, on the issue of waste and packaging, the green bar being really feeling a sense that they can have an impact as we move through some of the broader issues, how workers are treated, climate change or poverty, a lower sense of empowerment. And when it comes to then converting that into decisions, we do see, particularly this was actually done in May, and we started introducing the idea of hygienic packaging. Lower price still actually supersedes the priority towards either hygienic or eco-friendly packaging when making a decision. There's a lot of talk about how we might behave differently, and this question looks at whether or not people see that they might eat healthier, but also in the yellow, whether they have eaten healthier. This is from May of this year, so in the midst of the pandemic for many countries. And we see about 8 in 10, 77% worldwide say that they will eat healthier, but in fact, in the midst of this, about 1 in 3 have. And there is a lot of hesitancy about how to manage this say-do gap. And what we would say is that just because it exists is not a reason to not drive consumers to understand how they can act and how to overcome some of those barriers. And one of these is the motivation. So if we take the case study on organic foods, which is more important, is it health over environment? We see actually the personal health, 46%, trumps the good of the environment 2 to 1. And that does vary by country. You can see the variations here. And in some countries, either both or neither of those actually taking the priority. The other thing we find consistently is there is variations, of course, across age, although the idea that this is purely driven by the younger generation is not something that we see consistently in our data. So here we do see that the environment's slightly stronger for that group, the under 25, but in some of our other measures, we see actually the boomers having a higher driving force. And we are, as we track through our social media and other activities, seeing conversations about how the pandemic has changed, whether it be air quality or how people are treating products. And I think this is something that we will assess and see how this moves forward as we emerge into what Chris described as that uncertain normality. So what are the implications? First of all, there is a need to differentiate. When we ask about how companies perform, there are very few that stand out. So that is both an opportunity and in some ways a challenge. There's a need to simplify the language. Sustainability is not well understood and it doesn't actually connect very well with people. And while it may be broad in definition, it's quite limiting in terms of what it means and what it conveys. a need to really speak to the consumer benefit. It's not sufficient for consumers just to feel good about what they're doing in most cases. There's actually room to take this citizen consumer beyond waste and packaging and demonstrate some of the broader benefits. And as I said, while there is this infamous say-do gap, it is not a reason, it's a reason not to proceed. Citizen consumers can be indeed motivated with the proper messaging and the proper goals and targets. And on that, I will hand back to Jennifer to conclude for today.
Thank you very much, Natalie, for sharing this this perspective. It's very interesting to see that you're mentioning that there's very little differentiation. So brands tend to be. It's funny because in one of our previous signals, we were talking about the lack of differentiation and communication during COVID.
Right.
And this lack of differentiation is something that is across many topics for brands, right? But what seems to come out from what you presented is that there is an opportunity to work on this, and there is an opportunity to take this seriously, and people are ready to listen to stuff that is not just directly COVID related these days, right? And so as we move forward and we plan our activities, we need as brands and companies to take this into account. What would you say about this, Natalie?
No, absolutely. And I think, Diego, you mentioned this as well about people will become loyal, and we've actually asked and investigated, am I following brands during this time? And we do find that that is the case, that we've also asked about, do I rely on traditional brands versus maybe some of the newer brands? And there's, while there is maybe a historical lack of differentiation, something like this is a time like no other to find that space where you feel that you are authentic, that you have a place to play, and to communicate on that effectively with a message. And there is actually a lot of opportunity to break through right now, and consumers are both willing and in some ways anxious to hear and to listen how people are responding and how brands are dealing with the needs and the emerging needs, and being respectful of the circumstances under which we're all living.
Great. Thank you so much for those additional thoughts, Natalie. And thank you to all of our speakers for sharing their perspectives today. And thank you as well to all of you who have been with us and listening. And we will be back in about 3 weeks' time, Simon, right? For our last Signals webinar before the summer break, let's say. So we look forward to hosting you all next time as well. And with this, bye-bye to everyone. Have a lovely rest of the day.
Thank you.
Thank you, everyone. Have a nice day.